Kuta-Richardson 20, Cronbach's alpha, and reliability coefficient are just some of the interchangeable terms that you may see show up on an exam analysis report or even on the C&E exam. Welcome back, everybody, to Dr. Sellars Educate, where our mission is simple, and it is to support all nurse educators to achieve nurse educator excellence. For some of you that are on the journey to achieve C&E, we are delighted that you are back. We know the journey can be long, and our mission is to support you until you are successful, no matter how long that takes. For those that are tuning in just to become a better nurse educator, we are here to support you on your journey as well. In this Snapshot series, we're continuing to explore exam analysis. Now, for some of you, this is not a large gap area. For others of you, you may continue to be struggling with this specific concepts related to this term. So what is it that you want to know? Well, first of all, it's all about having the right resources. We want you to make sure you use in Billings and Halstead Teaching and Nursing, as well as Dr. Caputi's book. Now, Dr. Caputi's review book, it's going to be the 3rd chapter. And then in Billings and Halstead, there are several chapters you can review, but we want you to start in looking at chapter 24. Okay, pull out your highlighter just like you see in this picture and make sure that you've printed out your study worksheet every single time you show up for our Snapshot on our YouTube channel, or if you're listening to us on our podcast, Dr. Sellars Educate. We want to make sure you have that resource in front of you every single time. You may wonder, now, why do I need to write this down? I'm glad you asked. 70% of retention happens when we actually have to write something down. Okay, that's going to help us remember, that's going to help us connect better with the content, and ultimately it's going to help us stay on track and stay focused as we move one step closer to achieving nurse educator excellence related to these terms, or towards achieving success on the C&E exam. If you are on the journey for C&E clinical, the good news is you do not have to study exam analysis because there will not be questions on the exam related to this content, okay? For those of you that are on the journey, though, let's go ahead and jump into our content for this snapshot. Okay, so first I want to know, did you complete your exam analysis yet? All right, so if you did not, go ahead and grab this QR code, and you can complete this exam analysis after you complete the review of this snapshot today. Second, we want to make sure if you have done the exam analysis that you make sure you understand and have full comprehension of concepts related to these terms that we're talking about in the Snapshot series. Okay, so if this is the first time you are hearing about our exam analysis assessment, that's okay, you're in the right place. We want you to make sure you have these resources available, and you can always make a note as part of your debriefing process to review the content that we're going to cover as it relates to item discrimination in this episode. All right, so going back to our resources, you're going to start when it comes to evaluation in chapter 24, and then specific to exam analysis elements, chapter 25 is where you're going to focus. Okay, now when it comes to item discrimination, there are a couple of sections in Billings and Halstead that will help further guide you into comprehending some of these concepts. Okay, so on page 489, this is where you're going to see an entire paragraph around item discrimination. And then the second resource I would point out for each of you to use and highly recommend is going to be an actual item analysis report. Okay, so when we talk about exam analysis, there are 2 components. We have the overall exam review, and then we have each individual item analysis, okay? And that is what we're focusing on when we look at item discrimination. So how effective did we separate the performance between our high-performing students and our low-performing students? We would expect with our high-performing students that we write questions that allows us to validate that learning has happened. Okay, and for our low scoring students, it validates that learning has not happened. So let's take a look at our thought-provoking question. You know, every single time we have a snapshot, we like to have a thought-provoking question to make it more meaningful and practical for our time together. So let's take a look. The nurse educator is evaluating the results of a recent exam. When determining what actions to take based on the statistical analysis data, what would be the best next step to take for a point by serial correlation coefficient that's equal to 0.50? Okay, and this is for the correct option. We have 4 choices. No changes needed. B, revise the correct answer. C, revise the distractors. Or D, revise the question. Okay, so this is what I want you to consider when you get to a question on a CNE exam related to exam analysis. Okay, so first of all, don't get frustrated, don't get flustered. You want to stay calm, right? And we want to stay focused on, first of all, what is this question asking us? Okay, so that's what you want to think about when you get to a question. If you start to have a lot of anxiety, the minute you see an item analysis question on the exam, I want you to take a couple of deep breaths, and then we want you to simply think about, okay, what is this question asking me about? And then second of all, what is it that I know for sure related to this question? Okay, and then if you're still not able to determine the best answer, just skip the question right now. You have that availability, and just skip the question and come back to it when you're able to think logically about what the best answer is going to be. All right, so that's what you want to do right now. Go ahead and write that down on your study worksheet, thinking about what the question is asking you, and second of all, what is it that you know for sure related to this question? So let's just say when you get to this question, you're not even sure what a PBCC is. Well, what you want to think about is, okay, I know there are a couple of elements to every question, right? So I know that there's a correct option based on the exam blueprint and the guidelines that NLN is following as of right now. If you're watching this snapshot live, that would be January 2024. But if you're watching it as a replay, there may have been some changes with NLN. So we always recommend that you check the NLN website. That's nln.org, and then you will see the NLN certification tab at the top. All right, so let's just say you have no idea what point by serial correlation coefficient is, or you're not sure what PBCC stands for. First thing you want to do is think about, okay, I know what a correct option is. I know there are only 4 choices. There are 3 incorrect options and 1 correct option. Okay, so it's asking me, or it's giving me information about the correct option. And then I look at the choices. Well, it's talking about distractors and it's talking about correct options. So I want to think about, how do I discriminate how my learners have performed on an exam, right? And that is through the distractors. So again, you just want to go through that process of thinking about, what is this question asking me? And second of all, what is it that I know for sure? So let's talk about it. The definition of item discrimination is the degree to which test takers with high overall exam scores selected the correct option. We also have the range of what the point by serial correlation coefficient, or you may see it called discrimination index, depending on the software that is being used to complete your exam analysis and item analysis. Okay, so these are the ranges. If we have a point by serial correlation coefficient of less than 0.15, that is poor discrimination. So I'm not able to discriminate or see a difference between how my high performance students perform with this specific question and how my low scoring students perform on this question. We want to see discrimination between the two. All right, and then what you also want to consider is, what am I going to do with the information? All right, so we've talked about 3 different critical elements related to every single item analysis question you want to think about. Okay, so as you're laying out what your study plan is going to be, number 1 is the definition. Okay, what is the definition of item discrimination? Number 2, what is the range? What is the normal range? What's the high range? What's the low range? And what's acceptable for the specific variable that I'm looking at with exam analysis process? And then third of all, what am I going to do with that information? This is a process that you want to think through during your study plan, and as you identify what your learning gaps are. If you're not able to answer those 3 questions, then you want to make sure you add additional time to your study plan to review the content. The second element you want to consider is the number positive or negative when we talk about discrimination. If we have a positive number for the correct option, that is a good thing. That is what we want. We always want the correct option to be positive. Why is that? Well, that tells us that test takers who scored higher on the exam selected the correct answer more often than test takers who scored lower on the exam. Okay, so that's positive for the correct option. If our correct option is negative, it means that test takers who scored lower on the exam selected the correct answer more often than our test takers who scored higher on the exam. So what do we want to do with that information? Well, what we know is that we're not able to. So what is it that we want to do with this information? Well, we know that we're not able to validate that learning has happened with our high-performing students. So we want to consider what those numbers are, okay, based on the discrimination scale that we have. And then once we determine what the number is, we can then determine what our next steps are going to be. Because remember, we're looking for the number and we're looking to determine whether it was positive or negative. We want that correct option to be positive. That means we've done a good job of not only validating that learning has happened with our high-performing students, but we've also written an effective exam question option, the correct option. That's what the story that the exam analysis report would tell us. So if you chose A, no changes are needed, you are correct. Now I want you to celebrate that if you did choose A. I want you to celebrate even more if you know why you chose A, right? If it just wasn't the best guess. B says revise the correct answer. Well, we know that a PBCC of 0.50 is a good indicator, right? When we take a look back, we want our PBCC to be greater than 0.40. That's going to indicate excellent discrimination, right? So any number that's above that 0.15 is going to be satisfactory, good, or excellent, depending on exactly where that number falls. All right, and then next, looking at revise the distractors. Well, did the answer or the question give us any information about distractors? No. Indeed, C is a distractor to try to attract you, try to trick you into choosing C. Okay, so we don't know anything about the distractor. And then revising the question, there's no need for that because we have effective discrimination between our correct option, which we know is PBCC, positive, and it's 0.5. We looked at both of those factors. We hope this information has been helpful. As always, if you have any further questions that we can help assist you with, if you still feel like it's a muddy point for you, reach out to us, info@drsellarseducate.com, and we will see you next time. Have a great one, everybody.